and welcome to another session of India IVF Summit. I'm Riddhi Lakra, Assistant Editor, IHW.TV. As we discussed in the first session, how the implementation of ART bill will help people ease the way how people see and perceive the assisted reproductive technologies. We also talked about the lifestyle changes and the genetic disorders that contribute to infertility. While we have understood the numerous options for conceiving through IVFs and other assisted reproductive technologies, there is still a misconception around infertility in India. Reproductive health knowledge and awareness is nascent in India, and many couples remain unaware of the available options for conception. There are many myths around IVF. For example, that the IVF results in child born with birth defects, that the process will deplete the eggs from the woman's ovaries, or that the IVF can only succeed in young couples. There is an acute need to disseminate scientific information so that the couples can make informed decisions. And it is important that we create positive awareness around infertility and dispel all the myths. To discuss this, we have with us today Dr. Rajul Tyagi. Dr. Tyagi, she's a director at the Javitri Hospital and the Test Tube Baby Center. Joining us, we have Dr. Mahesh Koregol. Dr. Mahesh is the infertility expert at the Nova IVF Fertility, Bangalore. We also have with us Dr. Ameet Patki. Dr. Ameet is a medical director at Fertility Associates, Mumbai. We have with us Jayesh Amin. Dr. Jayesh is a clinical director at the Wings IVF Group. And last, we have Dr. Bharti Dore Patil. Dr. Dore Patil is an infertility specialist at the Nova IVF, Pune. I welcome you all for the panel discussion at the third India IVF Summit.
A very good afternoon to you.
Thank you, Dr. Mahesh here, and I welcome you all for the session.
Yes, let me just start with Dr. Mahesh first.
Yes, please.
Dr. Mahesh, to understand, we have seen through the various studies and what we have gone through, it is observed that there is a stereotypical belief and there is an orthodox approach in terms of the medical prevention, in terms of the infertility, which is more oriented towards the women than men. Do you think is there a way we can bring a change amongst people and also talk about the equal responsibilities among both the genders?
Yes, because it is mainly a gender sensitization that is required, and it is so many situations that we see that even the semen analysis is not done by husband, and it is pushed over everything on the wife's head. And this is the attitude that needs to be changed by education, counseling, and now we are seeing a lot of change already than what it was before. I think further education and awareness about the semen analysis and other parameters are something that we need to look at. And we need to educate men also and sensitize men along during the curriculum development itself. When we explain about the reproductive system, I think we need to make them understand and explain that these are the things that can happen even for the men. And I think the gender sensitization is much required, because sometimes you see the azoospermia not tested, but all the tests have been done on the wife. So I think this is something that is not to be woman not to be blamed all the times, and we need to educate and spread awareness about the male fertility issues.
Dr. Ameet, you were trying to...
So the biggest myth in infertility that it is female directed. To be very honest, only 40% of all cases are only female related causes. There are 30% of couples where there is male related causes, and the other 30% are where both male and female. So it is an equal that there is male factor in fertility, and that is the biggest myth that it is only female related. And as a practice for the last 25 years, I always tell all couples that the first time they come for consultations, they have to come together, because that means it is an equal responsibility, because both need to come down to me for their consultations. It always happens that the woman comes with some other woman relative, because they always feel it is only women directed. I think the small things that we tell them, that the couple has to come together, because when you understand that they're sharing the responsibility and there could be a problem in the male.
Dr. Ameet, just to add on to your question, there is a lot of shame associated with male infertility, and men generally avoid the fertility testing. How do you think we can remove the stigma around male fertility?
And you
So as
asking
I
me?
said, 30% of cases are male factor infertility. So, and unfortunately, not only in our country, but worldwide, infertility is equated to virality. So whenever you tell any male that they have a problem to father a child, it is understood that perhaps they do not have that manliness, as they call it, to be the husband or to procure a child. And we must make them understand that male factor infertility has nothing to do with virility or the ability to have sex with his wife. So that is the biggest problem. I think it is important that we bring awareness. It's not only us, but it is family physicians, general gynecologists need to be made aware that a large number of couples have problems only in the male factor, and that is why it is important. The first and the basic test in any couple is to do a semen analysis. It is very easy, it is not very expensive, but will rule out 30% of causes of infertility. And I think it is awareness, as we said, talking about it, scientific articles in newspapers, in lay magazines, where we talk about male factor infertility will bring about a large amount of change in the attitudes of men who may have problems.
Thank you, Dr. Patki. Just to understand, Dr. Amin, coming to you, we have seen that even the lifestyle factors also play an important role. And Dr. Patki was talking about the awareness. So as an IVF specialist, how do you think like a right information can be sent out to people in terms of the various, living a healthy lifestyle? Dr. Jayesh.
See, it's very, yeah, rightly said by Dr. Amit Patki regarding the regardless of the, and you are sharing about the male infertility awareness. As far as concerned, the if you see the basic cause that why we are raising, why infertility is raising, there are two major factors from the society. One is lifestyle, and second is the marital age, right? That marital age is increasing, right, for a female. So in lifestyle, we know that certain things, two, three things are I already used to say my patient. Then when they are having unexplained, undiagnosed infertility and repeatedly asking a question, Dr. Jayesh, what is the reason behind me of this infertility? Then I will always say there are three enemy in our Indian environment, that is called pollution, pesticides and radiations, right? So even though whatever the things we are not get rid of these three, pollution, pesticide, anything, anywhere we are living, we have our pollutions, we have a pesticides, because we cannot get rid the good healthy diet, even pesticide free diet. It is something, it is very difficult to find out. And radiation, yes, we are using mobiles and towers and everything is there. So this is in our lifestyle, the radiation is always there. We are putting mobile, we are always surrounding our Wi-Fi systems, and we are so techo people at present. So this is one of the involvement. Second thing, another most important in a lifestyle, that because in the career oriented, that people do have a some work, maybe we can say something, they have a work in the more in the late nights also, and because of the stress, so the stress is so increasing, all the stress busters, maybe alcohol and smoking. If you ask me that in a last recent year, the survey is saying that in Indian community also, the female smoking is increasing in a bigger way. So that smoking also injurious to health also, for the especially for the female. Alcohol consumption is also increasing day by day. This is also one of the part of the lifestyle. taking together also, we all are knowing that our kids and also the new generations are having a habit to have a working lunch where they are getting something which is not our staple food. Maybe we are getting more focus on the junk food and the high calorie diet sometimes, right? I'm not talking to all, but these all things make one more obesity, means one more lifestyle in this problem. It is called the obesity, because India is now having a facing around 40 to 45. If you see the Google search, all the numbers, then we have a 40 to 45% people, those who are suffering from the obesity. At least I think so, where at least around 20 to 25%, which is related to our fertility problems, where we are dealing with the obesity also. So looking to all together, I think so we should be more aware now. Healthy lifestyle is so important. Get rid of this all some the stress busters. Use it judiciously, or maybe not to use during the fertile period. That is also important. And how to quit, that awareness is also increasing, because before 10 years back, I'm not going to take a history, but now repeatedly women is asking me in a very repeatedly that should I take a drink during my this treatment or not. So these all things are increasing, right? So looking together, I think so we should be aware regarding all these lifestyle disorders, which is one of the major part of the infertility, major part. And then other cause, maybe genetic or age, is the second part. Most of the infertility which is arising from the community is lifestyle related involvement.
Yeah, if I can add something, Riddhi, with your permission, I
Yes.
think in lifestyle, what is important is that how it affects the fertility. The first and the foremost is, although our lifespan has increased, now people live for more longer years, but unfortunately, the window of fertility has remained the same. And that is something that women have to understand, that their fertility starts dropping down by the age of 35 and definitely by 40, even if we all are going to live till 75 and 80. And that is why it is important that even if they have career goals and aspirations and maybe some reasons to postpone fertility, it is extremely important that they try and finish it off before the age of 35. Women also have a notion thinking that they can get pregnant at the age of 50, 55 because they read that in the media. And this is something which is a misconception. Media puts something which is rare, which is not normal. So we must understand that those who conceive after the age of 45 and 50 definitely are resorting to donor gametes, which lay people don't understand. So I think it is extremely important, in addition to what Dr. Amin has said. I think because of busy lifestyles, different cities that they both live, because of different timings, the first question I ask them is their sex frequency. And believe me, more than 50 to 60% of couples have very, very poor frequency of sex or coitus. And that itself decreases their chance of pregnancy.
Dr. Mahesh, I want to also include you in this topic about like the lifestyle factor. So is it like when we talk about the various lifestyle factors, being unhealthy and living a not like a healthy lifestyle, so is it both I mean only the women to be talked about, or is it the men also? So maybe the drinking habits, maybe sedentary lifestyle also can bring about different change in the men, and their infertility can also be questioned.
Yeah, that's a very good question. In fact, I would like to tell 5 things. Number one, the lifestyle, in the sense, the activity of sex in earlier days used to be for the pleasure to start with. Now nobody is thinking, they are doing it as a duty, as a target, as an activity, which is not possible. And that is not the way that has to be done. That is number one. So unless you have time for it, unless you are relaxed your body, if you go at 10 o'clock in the night at home and you want to try, it is not possible because your body is not cooperating. If you see olden days, the government jobs, or my parents' time, they used to come back home at 5 p.m. So then there was enough time for them to unwind, relax, and then there was time for them to try. But then today it's not happening. And in the urban cities, the travel, the commute from the work to home takes a lot of many hours. And by the time you come, your back is so tired that you just want to eat and sleep. The first thing, first criteria for anybody is a hunger stomach. So once you eat, once you have good sleep, then only you are. It's a third need of the body, not the first need. So if you fulfill a good food and good sleep and good rest for the body, then you'll be relaxed. You can note that when you are on a holiday, you'll have more chance of trying, because that's when you're more relaxed. That's number one. So that's one of the lifestyles in urban cities that we see. Number two, the smoking is the one which causes kind of atherosclerosis and other related problems, and so smoking is more dangerous than alcohol, which needs to be stopped. Number three, there is, you want or you don't want, you have been eating pesticides, insecticides in your food. All the food what you are getting today has been laced with so many chemicals, so many pesticides. So even we used to wonder why these men from the villages are coming with such a low sperm parameters. Then we realized they spray the pesticides to the crop. So then these are the people we are seeing that it's in a big way affected. Even we think that rural area, nice air, nice water. If you see, there was a study recently published. Even the groundwater has so much of chemicals, so much of pesticides what they are drinking. So even villages are not spared. We think that village has a better clean environment. It is not true anymore because of the unscientific use of these pesticides, the fertilizers, and groundwater, as well as the vegetables and all of it spoiled. And number four, the interaction and the harmony between the couple I see is a little bit lacking than the earlier days, because there's a lot of fights and then they take the fights to the bed. So जो होता है एक दिन में, by the time you sleep, Mia Bibi has to forget. It doesn't happen. It drags on. Their parents jump in, and then there is no, whenever you go to the bed, then instead of having a good time, they are going to have these fights in the mind, lingering, and these, we see a lot of social disturbances among the couple. Unlike the olden days, lot of disharmony is there. That is number four. Number five, the couple as such want to plan for a lot of days. They don't want to, they don't even try. They can use a contraception and try, but they don't try, and suddenly they come and say that we have erectile dysfunction, we have vaginal dysfunction, all other things. So whenever the God has given opportunity, we need to try and make good use of it.
Adding to that, in our Gujarat, if you say something, our Saurashtra division is there, and then so many other parts of the India, that tobacco chewing is really very much effective. How it is so effective on the male factor. So if I say something, the priority, then tobacco chewing is having a higher effect than smoking and then alcoholism. So there should be some awareness, because tobacco chewing is directly, and the sperms are so damaged that they are coming with a lot of male infertility in the certain certain southern part. Also in our Gujarat, we can consider in Saurashtra part where tobacco chewing is very higher. So that is also one of the part of the addictions of lifestyle, which we have to have a awareness to get rid of that addictions for a better output for the healthy parenthood.
Yes, Dr. Jayesh, thank you so much for that. And I would like to come to Dr. Patki and ask about how they we are aware about a lot of things now. That one of the things is that the lifestyle factors also play a very important role. And then we are aware about, some of them are aware about the IVFs, that there are IVFs, but then there is still a misconception somewhere that people tend to use, whatever available information is there on the internet, they go and they try to find out the information before going to their the expert. They try and find out, okay, this is what we can do before an IVF, this is the things we can do before IVF, how can we IVF be successful? So what do you think about such approach?
See, Google Doctor is already approached before they come and they see us, so which is there. But we must understand that this is like a double-edged sword. I'm quite happy for them to take some information from the net, from reliable sites, because that way they come a little better prepared, and quite often they ask pertinent questions which they would have perhaps not asked in their first visit. So I think it is the need of the hour that we as doctors have to equip ourselves with the latest knowledge, because sometimes they come with so much of latest techniques that frankly we also do not know that it is already in the market. But they have to understand that there has to be a realistic approach to this problem. They have read about something happened in Mayo Clinic, something happened in Harvard, and those things may not be applicable to our country, to our people. But it is important that I'm happy for them to read, to equip themselves with the knowledge, but I request them to go on reliable sites and not go on any sites which sometimes can be self-promoting themselves with some false information. So it's like a double-edged sword. If they don't do anything, they come too raw to us, then it is a lot of strain on my team to talk and counsel them. Some of them, if they come prepared with their questions, we can at that stage itself remove those myths that are there in them, and they understand that, okay, they have read something, but this may not be in practice in real life, and this is not something realistically possible.
Thank you, Dr. Patki, for that. And
No,
we
I
have,
just want to add something in this. See,
yes,
what
Dr.
happens? What happens is the infertility is something that is really exploited. I mean, a lot of people they have no idea where to go, what to do. Even you see the babas on the road sitting with a loudspeaker will say that all kinds of erectile dysfunction, because if patients are gullible, they don't know what is best, what is wrong, what is right, and their affordability range also we need to think. So it is awareness that we need to do, that not to fall prey to this unverified scientific data, non-scientific data. There's so many unverified things. Even you see a lot of even the fertility doctors also say, I'll do that, I'll do this, which are not substantiated by the evidence. So I think that is something, just the reason patient Googles, they find out, can you do this thing from somewhere in on the moon, it is being done, kind of thing. I mean, which is not substantiated scientifically, not to be done, but then somebody else is doing or somebody else is promoting it, they will ask it. So there is a need to differentiate from not, even some non-allopathic doctors will promote that this is, this kind of a jadi booty of khao aapko ho jayega, ye ho jayega. You see a lot of people who waste their life doing all these things and they come back at the fag end of their reproductive years wherein no more eggs are left. I mean, these are the kinds of practices we think people should read about and understand what is scientifically evidence-based and what is the right to kind of treatment they should undergo, rather than falling prey to a lot of things, ifs and buts, and even sometimes somebody gives an ash out of somewhere and you get pregnant. It's not going to happen.
Thank you, Dr. Mahesh. Just to add on to this, only like the information, like we have a lot of information around IVF. We have a lot of information about infertility. If somebody is infertile, what they should do. But then there is a thing that when you see, as you mentioned about the different things, about the different online portals, Dr. Patki, that they are available. The information there, it's available. But when you see in a vernacular language, we do not have that. Dr. Bharti, if you can you answer this, like, or can I wait for another sometime? I'll wait for you.
Another 2 minutes.
Yes, yes. In meanwhile, I'll go to Dr. Jayesh. Just to ask you, Dr. Jayesh. So we have seen that there are international papers, there are English versions of content available for people to understand about infertility and IVF. But when you see in vernacular language, we have nothing. Whereas people tend, and obviously they would go to the roadside people for their infertility treatments. So how do you think we can come up with authentic information for the people around in India?
See, around in India, I can understand if you ask me for a urban area, you rightly said that we can have a lot of information, right? So for urban areas, people are used to read a lot of articles, and there are also people are writing in websites. Lot of information is there. Rest of the other than the rural area, still to penetrate, we should have to have some circulations of the we can have some circulation of the writing some about the infertility, the small thing, basic things, that what is infertility and how it occurs, what are the causes, where lifestyle, how it involves, which are the bad habits which is also include. I think so. We all, as a doctor group, we all are doing certain things and spreading all these things by writing all our small articles and spreading it by pamphlet in the small villages. Apart from that, what our two organizations, maybe ISAR, IFS, we all people are going to take some continuous medical educations to the doctors, those who are situated there. So we are taking a lectures of the primary lectures to the what is primary infertility, which are then whatever the updates are coming, that I think so rightly informed from the bigger organizations. Even our gynec use organization means Foxy is also trying to aware by putting there some awareness program inside the society. So this is all will be done in, already in a process by the doctors and the organizations from our society. I think so. Apart from that, to help and serve to the very poor community going forward, it has been done by the doctors are always there. They are going in the villages and they are giving the free of charge camps where they can treat and give some medications. And again, when they go there, also again there is information, because you are passing the information in the form of their language. That is more important, because they will not catch the language which is you are saying in the metro cities, that all this e language which is you are going to give them. So looking to that, I think so these are the awareness program. I slowly and gradually, I think so if the IVF is available for going forward, if available in the smaller villages and everything, where I think so this is one of the part that awareness are spreading. And we as a doctor organizations, part of the organizations, we all trying our hard to put some more and more awareness launching programs, or the camp, or the distribution of the certain literature which will inform the community regarding the very poor community regarding the infertility.
Thank you so much, Dr. Jayesh, for that. And I hope these kind of initiatives of reaching out to the rural India would also help them out. Dr. Bharti is here. I would like to ask her, we were discussing about the various aspects, like how men infertility is not being talked about. We also came to the information part of it, like how there is a lot of information available and it is easily available and people tend to use that. Just to come to a very important aspect, a lot of young women read about that the PCOS is there, so they cannot conceive them. So is it a right way that the studies have shown that almost 1 in 5 women have PCOS in India, but can it lead to infertility, and can with that PCOS, can they conceive? So does IVF have a solution for that?
Yes. As you said correctly, PCOS is on a rise and we are diagnosing them because of maybe a lifestyle now. There's so much change in the lifestyle has made all patients who have been regularly ovulating, now they've been having a PCO, they don't ovulate properly. Because of they're not getting ovulation properly, probably the pregnancy conception is a difficult part for them. But PCOS is not a disorder or disease like where it cannot be treated at all. It can be treated, but it cannot be completely abolished or taken it out. It can be controlled. So, and with that control, definitely she can become pregnant. Only one has to make aware about themselves that they have to be very, very particular about their lifestyle, their diet, their weight. They have to be careful when they have been starting their fertility options. They should try for say maybe an year's time if they have a regular cycles, but if they don't have regular cycles, they must approach to a doctor. But it is not like how you said that PCO once is there and she will not conceive. It doesn't happen. But some PCOS, like PCOS is not one symptom. It's not like a say ovarian tumor or ovarian cyst is there, but PCOS is a heterogeneous disorder. It's a multiple things have been involved in that PCOS. So she would not come with one symptom, and that's how she goes to sometimes skin specialist, or she comes to a fertility specialist, or she will go to the common gynecologist, and that's how the treatment starts getting variable. So infertility, if she comes to the fertility specialist, if she's interested in fertility, she sure has the solution, and we may give her the pregnancy, so she need not to worry, but only we have to be very careful about treating her, how things has to be working for her specific phenotype. Phenotype means how the way she presents to us.
Can
Dr.
I add,
you want to say something?
can I add something to this, Riddhi?
Yes.
Now, let me give you some figures. PCOS is a problem which is there in the reproductive age group, and almost 18% of women have it. So, and it is on the rise. And a recent Indian research or an epidemiological study showed that 33% of adolescent girls in India have PCOS. So these are very frightening figures, and most of it is related to lifestyle disorders, wrong eating, less exercise, no dieting, and irregular hours. So I think it is a lifestyle disorder, and as Bharati very rightly put it, it can be treated. You cannot cure somebody from PCOS because it is inherently present in them, and if they do not change their lifestyle, the problem only gets worse. So I tell a woman that she will have to live with her PCOS, she'll have to make friends with the PCOS, but try and walk, diet, exercise, keep her BMI in control, and that is how she'll keep all the symptoms of PCOS under control.
Yeah, that's absolutely right. So she has to deal with it. So she cannot go away with it. She has to deal with it, and she should not be getting frightened because it is going to be there with her. It's a long-term disorder. So she's not going to go away from it, but then she can deal with it.
And most PCOS need multidisciplinary treatment, means it's a gynecologist, a dermatologist. We have lots of PCO girls who have got low self-image, low self-esteem because of their obesity, their hirsutism, loss of hair on the head. So they need a large amount of psychological counseling, and I think the family, the parents also have to be involved in telling them how they will empower this young girl or this adult to deal with this problem.
Yes.
Thank you both, Dr. Bharti and Dr. Ameet. Just to add on to the entire topic about the information, we also I want to ask all the four panelists here, the information what we get through internet about IVFs, about infertility is not right. I mean, it's not correct most of the time, and people like us, like a tech savvy person, would just go on internet and find out some information about us because we are scared to visit a doctor. So how do you think we can bring about a change in that, and how people actually can understand that the information available there and what problems we have is different? I mean, there is a huge difference what the generic information is available. So how do we categorize that, and how do you make people understand about that?
It is always not possible to extrapolate the data exactly as they are seeing. If you see as a headache, someone has a headache, they will see a Google headache and they will say that it is a brain cancer. Somebody has a severe stomachache for 5 days and they will find out that it's a colon cancer. That's how kind of education happens on the internet. So somebody reading about PCOS will think that all are kind of severe PCOS, which is leading to this end of life kind of fertility. It is not like that. So you cannot extrapolate exactly in verbatim what you are seeing on the internet. The PCOS could be a very harmless and small thing that could be there, or so many times it could be misdiagnosed as a PCOS, then it could be still normal, or a mild PCOS, which is not a concern at all. So I think whenever they read something online, whenever they get to hear from somebody that okay, they had this condition, this thing happened to them, and all those things, you visit a doctor to check about what you have read. Nothing wrong. Knowledge is power, empowering people with knowledge is education that many would do, and that is appreciated, that they are trying to read about it. But then verification of the fact, it's like fact finding. So verification of the fact is more important, and then it is advisable for them to go ahead and verify what they have read with the doctor, and then try to understand why it is not that, and why it is not this, and why it is not serious, and why it could be this. What are the options available for them to get out of this? So this is something that I would say, everybody,
Yeah.
please read up, please read up, please read more. I'm not saying no, but then write down your doubts, ask your doctor why it's not like this, why it is like this. Definitely you'll get an answer.
He's absolutely right. Dr. Mahesh, this is perfectly, because I always tell them that's an information. What you read is an information. You need a knowledge and you have to apply that also. And that's why information is definitely all right. You must, but with that information, you are not supposed to get into the knowledgeable science and start treating yourself. That would be very difficult, because if I have a irregular period, for example, I'm telling, the day before yesterday, patient had come to us. She said, I have a irregular menses, and that's irregular menses means I have a PCO. And that's how she started all PCO information on the net, and she started eating the diet accordingly. And she said, 6 months I'm going to do this all diet, and then approach to a doctor. Somehow one of my patients says, no, you have to approach madam and just see what she's saying. And can you believe that patient didn't had PCO, but she had a POI, that is called premature ovarian insufficiency. That means she doesn't have eggs. PCO has a lot of eggs, and here she doesn't have eggs, and that's why she was getting irregular menses. So information is okay, but from information, if you start understanding whether it is a knowledge and that has to be applicable to you, and you start applying that knowledge to you, that is where the things goes wrong. So lot of information, you must come out with your problems, your queries, and get the correct knowledge or the treatment options from the doctor. Again, you can go back. I tell them one further line, that once you know what is the treatment options for you, go back again and read that whatever you were read, and now you will understand how to correlate between these two things, and then take a decision what doctor has been saying. So this is what we urge to all our patients, not to have the information. You must have the information, but don't treat yourself, don't diagnose yourself. That will be disaster sometimes.
Riddhi, I have a slightly different take on this. Now, information on all medical illnesses, right from your head to toe, are there on the internet, and patients access that. But understand that infertility is different, and because even in the undergraduate syllabus of curriculum, infertility is not given that importance. Forget undergraduate, even in the postgraduate obstetrics and gynec course, infertility is not a big chapter, although in their practice, almost 25% of their patients are infertility. So the patients go to the internet because their routine GP, who is an undergraduate, has no clue about infertility treatment. So that is something which is completely wrong in our country. Infertility, for some reason, you will be amazed to know that 95% of infertility practice is in the private sector in India. Only 5% is in the public. So the government policies are not in favor of infertility. They do not think it is an illness or a disease. And that is why the knowledge is not there. And that is why the infertile couple especially needs to go on the internet, because their routine family doctor, family physician has no knowledge or is giving them some half-baked stories, because unfortunately he has not been trained and taught in his undergraduate days about infertility. So the problem lies there. Knowledge about all diseases is there on the internet, but that sets infertility away from the rest of the diseases.
I can add only that we all doctors, as a that we are always welcome that well-read patients are always good. because they should have some knowledge. So we are not going to say you don't go and don't read, and without coming you are without reading you are coming. So they are reading, they are getting the information. Only to rectification of the informations by the expertise, that is more important. So don't apply in your life. Before to read, it's fine, getting information is fine, but clinical applications in medical science, the clinical application should be only and only in the head, in the hand of the medical expertise. So you should take expertise advice, and then you implement. That is the only the message that we can say something regarding the Google read patients. Getting information, that's fine, but clinical applications should be always under the hand of the clinical expertise.
Yes, Dr. Jayesh. I would like to thank everyone for that answer. And Dr. Bharti, I would like to come to you that like counseling is a very important part of IVF. So a lot of patients, if they, I mean, a lot of couples, the first round of IVF fails, they generally tend not to come back. So how do you think that part of, like we were talking about the knowledge, though we get a lot of information from internet, but then you also stress on the part that knowledge is important here, talking to your doctor. So how do you think counseling can help people, couples come back and continue their IVF treatments?
Counseling has a utmost important, as you said correctly, they have to talk to the doctor has to sit in front of them, and they must give the time, especially when the patient comes. Three places I always emphasize counseling or doctor visit or consultant visit is very, very important. Number one, first visit. The first visit, the consultant has to be very cool, calm, and he has to give a time to the patient, analyze the whole detail, and that gives your counseling. And counseling always should be with compassion. It should not be what I have learned over a period of time, like last 30 years, that it's not only academic propositions what we give appeals to the patient. It appeals to the patient that how compassionate you are when you start talking to the patient. The moment you start showing the compassion, automatically their attention starts coming to you. And if you just give the figures and numbers, then they go away from, because they will be sitting in front of you, but their mind is not there. And once the mind is not there, they don't focus on what you have been talking. So with your counseling, if the compassion comes, that makes a lot of difference. This is a first visit. Then the second visit, I always tell, during your process, like IVF process or whatever, you must tell them truthful analysis of whatever is been going on. Truthful doesn't mean that you to hurt them, but in a very different and subtle manner, you must tell them if it is going fine or if it is not going fine, so that they start little preparation. You are not going to bang them on the last minute that something is not going right. So that is a middle portion of the process or journey. And the third very important is when IVF fails. If it is positive, then doesn't matter even if you don't talk to them also much, because they are already happy. But when, especially when they have been failed cycle, we must scientifically give them the answer why it is probability that these are the reasons why you must have failed. Usually what I see in my routine practice, that the patient once failed, they're completely devastated. They don't want to listen also what the logic is behind. So give them little time. Don't call them immediately. Don't call immediately. Let it sink. That failure should sink inside. And then they start logically thinking. I always tell my counselor or my reception front desk people, don't give immediate appointment to them. They are emotionally clouding is there. There's a lot of emotions are there right now. It is a surgeons of your emotions, and they will not understand what you have been talking to, and they may go haywire. So give 1 or 2 days time, and then sit down, give them the time properly, 20 minutes, 25 minutes, and then try and tell them, this is not end of the road. IVF fail is not end of the road. It is still, you have tested up to here. Let's see what next we can do and where we had been gone wrong or where we have been lacking. And this is the next step we have to take. That three parts, if you do, patients, I have seen patient doesn't go. They will keep on with you, but unless you explain them where exactly things are being heading towards, not wrong, not failure. And these all failure patients, very, very important it is for them to be very compassionate because they feel it is completely hopeless situation now in the life. So this is how I deal my patients. If you look at the counseling.
See, the dropout rates are not always because of financial constraints. Most dropouts are because of the emotional turmoil that has happened. And I think it is extremely important that we give them realistic expectations from the treatment. Most patients think that if they do IVF, ICSI, they are 100% going to get pregnant. I think it is very important that you write and you give them what their chances are as a couple. You look at them as a complete package and not only concentrate on their infertility, you look at their emotional quotient, offer them empathy. I think professional counseling is now mandatory by the new ART bill, so you must have a counselor to see them. And the patients who have failed, I see them in a separate OPD which is not busy. So you can give them that time to think, to explain, to recap what all you said and plan the way forward. So in our clinic, we plan the way forward before we start the treatment with realistic expectations of what the treatment is going to offer them. Patients sometimes don't hear what you are saying because they don't want to hear that. So we in our clinic write down the procedure, and at the end we write down what is going to be the cost and what is their success rate with their treatment, so that it remains with them when they go back home and they read that, they have a sense of what they are going through. Because quite often patients come and they say, oh, then you do IVF, do surrogacy, and they feel that is 100% end of the road. It is not true. And the dropouts are if you don't give them realistic expectations, very high expectations. You don't tell them the full treatment, because sometimes the treatment is told in such a rush that the patients don't realize the number of times they have to come, visit, see you, injections, all those things matter. So then it becomes too much of, they are overwhelmed with the emotions, and that's why they may not want to go for the second attempt or third attempt.
I will just add on only that counseling is so important in IVF, and it's varies in three part. One thing is that that is what Dr. Ameet Patki says, sharing the right information to the patient. And that's in today's era, I think so we are doing audio video. If you have a one audio video visual impact to the counseling, it will give a best understanding. Because if you say something again and again for a last 20 years, your counseling become again and again smaller and shorter and like that. So you should have an audio video slide presentations for the counseling. Second, I think so what a patient need, it is called connect. I will say this is the second part, that whatever the counselor, that their job is to connect illiterate people in a different way, the literate people in a different way, the poor people in a different way. So you should have to have a connection to the patients in different scenario, demography. And last, third point is more important, that Dr. Bharti Patel is saying, that sympathy. The last part is sympathy, because you need that. The failure is bound to occur in 50% of the all IVF patients, and it will be not addressed by the main clinician in a proper way, and that it will kill means it will increase your dropout ratio also, and it will kill your impressions also. So these all three things, I think so, right information. Second thing I say, the connect, and third thing I would like to say, sympathy. This three part, if it is managed by the any counseling part, then I think so patients are always very open to do to work again and again with you, even they fails.
Thank you, Dr. Jayesh, for that. Dr. Mahesh, I want to come and ask you, and to other panels as well. So there are different multiple myths around IVF that people can, it can cause multiple births. I mean, in terms of triplets or twins, and then I mean, even the children born can be premature or there can be defects in them. So how true is that?
It's a good question. What happens is, earlier days, why I'm telling earlier days is, as per new ART Act, you are not supposed to transfer more than 2 embryos. So that is one advantage. So new ART Act clearly says that at the maximum you can transfer 2, nothing more than 2. There were days when people used to transfer 4 embryos, 5 embryos, 6 embryos also, because they were not sure about the success. So these were the days. So then this misnomer or the twisted fact that came along with the IVF is, when there is IVF, there is going to be twins. Because the multiple birth order was very common because more embryos were transferred. So that is not wrong for them to think. But then with the onset of the new ART Act, we are going to transfer 1 embryo or at the maximum 2 embryo, and chance of multiple pregnancy are going to come down drastically than before. That is there. So we have to counsel the patient that it is possible to have only 1 baby if you wish. You can transfer 1 baby only, and there is a good chance, and it is more healthy. As a matter of fact, multiple pregnancy is considered as a complication, not a great achievement. So multiple pregnancy associated with a lot of problems during the pregnancy, like diabetes, hypertension, and a lot of things. So I think these related myths regarding not able to carry 1 baby is something that we need to counsel the patient and make them understand. And I'm sure they're going to understand that twins is not always the order of this.
Yes, thank you so much, Dr. Mahesh. Dr. Jayesh, I want to come and ask you. There's another myth that IVF technique is only for those who can conceive who cannot conceive naturally. So is that true? And are there other perks of conceiving through IVF?
See, it has been said that if you are having a long-standing infertility, you are not getting a pregnancy after certain years. Of course, people do have that last treatment is getting again for IVF. In between, there is a bridge treatment, natural intercourse and IVF. In between, there is a bridge treatment. It is a part of the ART nowadays. It is called IUI. So putting semen inside the uterine cavity at the time of the ovulation, that is also one of the way forward to get pregnancy. Now, when there is extreme level long-standing infertility, certain conditions like bilateral tubal block, certain condition like less than 5 million count, 0 count, these are the extreme, these are the indications where IVF is the only answer. And lastly, I can say something about it's not only to getting a baby, but there are some alternatives. So which are the other perks of IVF? That getting a genetic disease free. So there are a lot of monogenetic disorders. If you say something like repeated thalassemia disease, babies are born by the couple, both thalassemia minor couple. There are some Duchenne muscular dystrophy. There are so many monogenetic disorders which are in turn leads to the required help of a healthy embryo, right? So in this type of genetic disease, if you are a repeated genetic disease related abortion, in the community is considered as an abortion, loss of the pregnancy, all these things, preterm delivery, it has been found out there is some genetic disease abnormality. So it's not like that only to conceive, it also to get the healthy baby, where you can also apply the PGTM, so which is one of the part of the other perks of the IVF. Second part, nowadays, I think so, the advanced maternal, as Dr. Ameet Patki says that you need to complete your family during 30s. But I know that everything we know, but we are still, we cannot complete in today's era because of some competitions. And I think so day by day in metro cities like Mumbai, Delhi, everywhere, people are married at around 30 to 33 and they will planning after 35. That will be days will come within a 5-10 years, shorter time. Still our in metro cities, still we are 30, 32, we are getting a planning of pregnancy, but that day will come where after 35 and age-induced abortions are common, right? So if your age is more than 36, more than 37, then your multiple abortion, if this age-induced abortion, you can have also IVF where you can have a healthy baby and making a pregnancy. So this is also one of the part to use the IVF. And fourth part, if you have a recurrent pregnancy loss, though the data still not confirmed, I know that there are a lot of things in the medical science where data not confirmed, but clinical practice might help you. So if the recurrent pregnancy loss, yes, in that condition also sometimes it is making some genetic link is there, some CNV is there, copy number variables are finding out, some genetic translocations are there. Even all these conditions to reduce means to get a healthy baby, that is also one of the IVF. Now, last part, which is more important, that as you are saying, rightly said, that what is the future of IVF, and that is what we observed, that might be it is called in a cancer patients, I want to say, the using of the some alternative treatment, the cancer patient, breast cancer incidence is 31-32% and 15 to 60% in the younger women before they plan the kids, and they can go by the egg freezing. So this is also part of the IVF, right? So they have a egg freezing, and after completion of their the cancer treatments and everything, and after through 3 years or 4 years when they are become healthy, what about the happy life, right? So it's a healthy life, but what about the happiness? So happiness can be created, I think so, can be created by this type of all the cancers, even in the male or even in the female. If 80% cancers are curable, if they are detected at certain point where we can also have a egg freezing, even sperm freezing is also important in the male part, in the certain gastrointestinal cancer, before the any chemotherapy and everything, we can have a freeze the eggs. Might not we know that some disease of the female, and also I think so I'm coming out some campaign like freeze your future, right? Freeze your future. So that is also important for a certain ladies, because I have a lot of queries of the corporate from corporate sectors, those who still not decided for marriage and they want to freeze their future. So that is also one of the part of the IVF. So these are the all things, I think so, lot of things are there. Genetics, the tissue freezing, egg freezing, and I think so, I already say, to prevent the genetic disease, all these things will even I think so, the savior baby is still ethically how it's going on, I don't know, but you can also produce a savior baby, right? You have a thalassemia major baby who is getting a treatment, and then you can produce a sibling which is actually match to that baby, and you can also have a transfusion, bone marrow transfusions, and have a savior, the existing baby. So the savior baby concept, these are the different part of the IVF, and I think so we all people, I think so, whatever the panelists are there, they are so experienced and they know everything, and they are all are serving and doing in a routine whenever it is required.
So there is something called as social IVF in addition to medical IVF, and I think Dr. Jayesh was enumerating all the reasons for social IVF, like egg freezing. It is also, we know that sometimes we need to do sperm freezing if the husbands are not in the town or they are both traveling, may not be present. So social reason for IVF is also there. Egg freezing for cancer patients, egg freezing for social reasons, and PGTA will also be one of the reasons for, not for patients who can conceive, but we don't want them to conceive naturally because we want to screen their embryos before we transfer. As regards your previous question of IVF pregnancies giving rise to babies with defects, now you must understand it is an inherent problem of the couple that you're looking. If you're treating somebody at 39, 40, 41, it is not the process of IVF, but it is the inherently found in these elderly women. And that is why they're termed as high risk pregnancies, or even they may have abnormalities. But this has got nothing to do with the process or the procedure. It is the inherent reason why they have first come to you in the first place.
Thank you so much, Dr. Ameet. Dr. Bharti, if you're here, one last question to you. Dr. Bharti.
I would like to say, see, you first question of yours was who can seek the advice, infertility advice or IVF when they're naturally not conceiving. So how will you define yourself, like when you need to go for a treatment, especially? So WHO, according to WHO, if you take 100 couples in front of you, 90% of the couples should conceive or conceives if they have an unprotected intercourse for 1 year down the line. So if they don't conceive in 1 year down the line, when she is less than 35 years. See, the woman's age is very important. If she is less than 35 years of age and they are trying after the marriage 1 year unprotected intercourse, they should conceive. 90% of them conceives. The 10 to 15% of the patients couples who don't conceive, those patients we should start seeking the advice or at least investigations. Now, more than 35 years of age, woman's age, she has only 6 months, not 1 year, but 6 months down the line, they should start at least seeking the doctor. Now, this is what the first question of yours answers. And then if suppose a patient is going, like you said, other perks of IVF, what different perks we have in IVF, is suppose a couple, a female comes, say, maybe 28 years or 35 years of age or 32 years of age, and she doesn't have the eggs. Her AMH is very low, which is very, very common in India. In Southeast Asians, we are 6 years before menopausal. So our ovarian reserve goes very fast down. So maybe a patient who is 28 or 30 years of age and she has a very low AMH, that is anti-Müllerian hormone, or almost negligible eggs are there. In that condition, she can go for egg donor IVF cycle, and that's very authentic. And that is another way IVF is being boomed. So many females who have less ovarian reserve, they can go for egg donor IVF cycle. So the same thing was actually for even surrogacy also. But now with this law, there can be a surrogacy, but it has to be altruistic. But then if suppose she doesn't have uterus at all, or she has been unfortunate that during the period of her previous pregnancy, her uterus has been removed, so she definitely has still chance to get the child through the surrogacy. So these are the different, other than Dr. Jayesh and Dr. Ameet said, these are the few different points I just wanted to tell you. And you asked the third question, whether they have a premature delivery or they have any different obstetric complications if the patient is conceived through IVF. Surely, patients, because usually patients are more than 32 or 33 years of age when they come to IVF treatment, and naturally with age related, they have these all complications there. Because in the data, it has been, I think, it's been proved that they will have a more IUGR, hypertension, and then they will have a premature delivery possibility because twin pregnancy or multiple pregnancies. So these all complications could be there, but it is not that high that we should be bothered about not getting the treatment. Is that okay?
Yes, yes. Thank you, Dr. Bharti. Just another one. We often see in the movies that there's a myth that the eggs get, the sperms get exchanged, like in the movie Good News.
No. Now that is actually fiction. Actually, they just wanted to, see, how will you get entertained unless if you see plainly, if you talk, how many people will listen to our talk also? Something fiction has to be there unless and until there will not be a curiosity of the page. But it doesn't happen like that, because nowadays so it is very double witness it is, and usually it doesn't happen unless and until patient gives the consent for the donor sperm. We do not use the sperm donor, or it will not happen that this one goes to there and that one, because everything has been labeled. So people are very responsible. They know that these are the gametes. So it just sometimes might be somewhere it has happened, but that gets highlighted. You all know that. Good things doesn't spread so fast, but the bad thing spreads so quickly.
Everything is coded and there is double witness. If only you believe in the movies that hero in real life can manage 4 rogues, then you should only believe this.
Very true, very true.
Thank you so much, everybody.